My name is Ravi Muruganandham. I'm the IT project manager at Parkview Medical Centre. I've been in this role for close to 3 years. In my role, I'm responsible for managing projects from inception to completion. That includes procuring new products and implementation and rolling off to support. Prior to Silhouette, there wasn't a good system in place. People were using different models of cameras and they were taking pictures which were not consistent because they were using different models and they were capturing it in different ways. So it was not consistent, and there was a laborious process that they were employing at that time where they captured the photos, and it can take some time before it's scanned in and made it part of the patient record, and it was kind of a band-aid process. It wasn't seamless, it wasn't fully integrated with Meditech, so it was not an ideal system for clinicians, physicians, or the wound nurses. Initially, we purchased 18 cameras and we started rolling out at the outpatient wound center first with 2 cameras there. And they were the pilot facility as well for Parkview. So it started at outpatient wound center, and then once we deployed there, we deployed for inpatient wound nurses, 3 cameras there, and then we expanded the deployment to other nursing units across the hospitals. All our nursing floors have Silhouette in place now. At Parkview, we use Meditech as our EMR. So we do all our wound documentation in Meditech. So what that means is they use the Silhouette software, Silhouette Connect, to capture the images, and that's where they file it. But we have a cold feed interface going out from Silhouette to Meditech. By cold feed, I mean it's a PDF file. So Silhouette drops these PDF files periodically, and Meditech has an interface that we pick up within a matter of minutes once it's finalized from Silhouette, and it goes into the patient chart part of Meditech. So clinicians, it can be physicians or nurses, they can pull up the images within minutes of it being captured in Silhouette. Once they sync it, it's part of the patient record. They can pull up the patient anywhere in the hospital once it's part of the medical record. It's not a significant training need for a system like this, so we spend an hour trying to train somebody new for a basic usage of the system. So we have super users who are adept with the system, so they go through the periodic nurse training that we have. So we spend about 45 minutes to an hour where these super users train the new nurses on the system, and we have the training material that we need in place. Silhouette is a great system, probably the best in the market that I've seen when we procured the system. The inpatient nurses, wound nurses, and outpatient, they love the system. There is no question about that. It's a great system, and it makes their job efficient with the standard way of capturing wound images, and it's right there and part of the patient record.